Shortly after I first got to Zusman, I received a phone call from the facility where I had trained. They wanted to refer a patient to me, someone who I had taken care of while I was still a fellow there. She was 22, and she had Hodgkin's lymphoma, and they wanted to know if they could give her my number. And she called me directly, and she said in this adorable voice that she always spoke in, "Hi, Dr. Hirsh. Can you come to my house and convince my mom that I need hospice?" And so the chaplain, Deaconess Frank, and myself went to visit this young patient. She was 22, and talk with her, her brother, and her mom about how hospice services could help them. They were not ready to accept that this was the end of her life, although she was coming to grips with that. The individual who is dying is often aware of that fact long before any physicians are, any clinicians, certainly before their family is aware. And we ended up bringing her into the inpatient unit for a few weeks. The goal was to get her symptoms under control. She had a lot of pain and a lot of itching at the time. And in the 2 weeks that she was here, she was taken care of by our nursing staff, our aides, and visited regularly by our chaplain. And she had, through most of my relationship with her, had always felt very strongly that she would be saved. And for her, that was a literal interpretation. Her family were very devout Christians. And we discussed, does saving mean do we mean that figuratively? Do we mean that literally? And she really believed that it was a literal. I mean, she believed that literally. But after being here for a few weeks, having seen other patients come and go, some of whom left after passing away here, she actually asked one of our nurses if she had ever seen someone die. And our nurse responded, "Yes, I have." And this young woman said, "Are they sleeping?" And our nurse went on to just talk a little bit about the dying process with her. And that was sort of the first time that she had acknowledged that she herself was thinking about death. A day or two later, her chaplain from the outside community came in to visit her. And she herself has colon cancer and had been undergoing therapy for that, had undergone chemotherapy. And another one of our nurses approached our patient and said, "Oh, I understand your chaplain from your local church also has cancer. You have taken much of this, your journeys have overlapped, or you have experienced much of the same journey." And our young patient said, "Yes, but my journey is coming to an end." And that was 2 days before she began the active dying process. And it was before any of us as clinicians would have predicted that she was that close to death. But in being here for those 2 weeks, she was really able to get comfortable with the idea of dying, both physically. I think we helped her overcome some of her fears of how dying occurs. Is it painful? Are you struggling to breathe? So she was able to talk with nurses day after day, nurses who specialize in caring for people who are dying, as opposed to nurses at cancer hospitals who specialize in helping people through cancer therapy. So she was able to ask a lot of questions and just sort of absorb, understand a little bit more about what the process would be like. She was able to just appreciate the energy of Zusman House, be comforted and reassured by our aides who were in her room, many, many hours every day, our nurses, our chaplains, our social worker. And towards the very end of her life, she recognized that was coming long before she underwent any of the physical changes that would tell us that she was approaching death.